So you've been prescribed antidepressants and you've been told to go see a therapist. Do you need both? Because cost of living means you're having to make tough choices. Good day, I'm Dr. Tia, and today I thought I'll introduce the swimming analogy to explain why seeing a therapist is an integral part of management of mental illness. The analogy I use is the swimming analogy. Now, everyone ideally should learn how to swim. And in life, we understand that it's not all rainbows and unicorns, but we need to learn how to process our emotions, emotionally regulate, and develop insight into our thinking patterns and what we have, developed to help us survive until the ages that we are, what might be helpful, what might need to change. That's where you use a therapist. Now, when someone has anxiety or depression, they can be categorized as mild, moderate, and severe. In mild depression, going back to the swimming analogy, you are basically entering your swimming lesson with your therapist in the shallow end of the pool. And in the shallow end of the pool, yes, you'll be asked to blow bubbles, use a kickboard, and, get under the water. But your brain knows that if it gets too hard, you can always stand up to breathe. In severe levels of anxiety depression, that swimming analogy means that you are actually entering your swim lesson in the deep end of the pool. And in the deep end of the pool, most people can't touch the floor and be breathing at the same time. And so your brain is like in WTF mode, I can't breathe, and is in panic mode. And in panic mode, regardless of how amazing your swimming instructor is, your brain is not learning. Your brain is not ready to learn. Your brain is like in survival mode, which then means therapy becomes a bit challenging. Now, that is particularly when a consideration of medication is helpful. Not because medication fixes anything, that's an asterisk on that comment, but because medication acts as a floaty. It reduces the level of distress that someone is undergoing and helps therefore facilitate therapy. Sometimes I have patients who are like, no, I want to do everything natural and I don't want to be on medication. When their levels of distress are high, I'm always open. At the end of the day, I don't run a paternalistic consultation room. I am there to help guide and give you advice. And at the end of the day, me and you are working together to help you, but we should both be comfortable with what I'm offering. And so I will send that patient to the therapist and advise them that sometimes therapy becomes really hard when your brain is in survival mode, when your brain thinks that you're gonna die, going back to that swimming analogy. And sometimes a therapist will send them back to me to say, hey, we've hit a roadblock because we are unable to focus, we are unable to apply what I as a therapist is recommending. Everything is just too hard. That's when medications shine, because medications work by acting as a floaty and giving your brain a breather. It doesn't mean that you don't need a therapist, and it doesn't mean that it's long term. But when your levels of distress are high, the last thing your brain is open for is learning, which a therapist is going to be there and challenge your thinking patterns and challenge how you got there and what keeps you there. And that can't happen when your brain is in survival mode. Now, often we then stop medications at some point. We never start antidepressants with the goal of someone being on them forever. And life might be going along well until you get caught in a rip, which the beach lifeguards will tell you that if you're caught in a rip, you have to swim parallel to the shore. But if you are caught in a rip, because a swimming pool lesson is very different to a beach lesson, then you might need to get back on meds. But that's a conversation for a different time. But I thought I'll just explain how the two, a swimming instructor and a floating device, play different roles for different people at different levels of their psychological distress. Hope that's helpful. Till next time.